Did you know that you can be euthanized in Canada? They call it MAiD, which means medical assistance in dying. It's basically legally assisted suicide? Maybe you already knew that and I'm just ignorant. But what even further shocked me was this. MAiD eligibility should expand to minors, patients with mental illness, report recommends. What? I can understand the argument for MAiD for people who are maybe terminally ill or experiencing excruciating pain where there is no treatment to help, but MAiD for patients with mental illness? How is this even a discussion? Psychiatrists describe their fears that mental health patients who could recover might instead choose assisted death. This seems obvious, right? If mental health reasons were to be amended into this MAiD law, basically people who were feeling, let's say, depressed for a few weeks could choose to take advantage of this MAiD law in order to help themselves. Instead of trying to pull themselves out of it or go see professional help or whatever it may be, the government will just send over a doctor or nurse practitioner to your door to assist you in dying. What a horrible job that would be. This led me to wonder, are there people supporting medically assisted and dying for people with mental health struggles, mental illness?
Do you support medically assisted dying for people who suffer from mental illness?
Yeah, that's incredibly complicated situation. I find in general, I think it's a positive thing.
Positive thing? Showing our coming generations that when the going gets tough with your mental health, you can just opt out of life? No, that's not a positive impact in society.
A lot of mental illnesses can be overcome with the proper coaching, the psychological counseling.
Yes, you should always fight to overcome adversity. Choosing to quit or to give up is not what I want my kids to learn.
Personally, I don't, because I think that for mental issues, I still think that we should first make sure that everything is exhausted for help with that. And I think right now that help is not there. It's not enough help is there so the easy way out is just to say, okay, let's do medically assisted, end of life and we should, I think, be not addressing it that way.
Instead of putting money into this MAiD program, why don't we reallocate that money into funding mental health resources for these people that are struggling with mental health? One resource that will be available to all who struggle with mental health is 10 Minutes to Feel Less Anxious, my new book, which comes out March 31st. But if you're like me and you're going to forget about that date, you can go ahead and pre-order it today. That way it automatically ships out to you on the 31st. If you want to learn how to be proactive with your mental health and learn the steps to improve your mental health on a day-to-day basis, this book is for you. Go to feellessanxious.com to pre-order now. Back to Canada.
Yes, I think anybody has the right to die without any reason whatsoever.
I respect the opinion, but I completely disagree. Everyone can agree that we want suicide rates to go down, right? Then why would we be okay with people opting into medical assistance and dying, aka assisted suicide? It's preposterous.
If someone who's clearly conscious says, I would like to die, that's their business and they should be allowed to die. Yeah, even if they're not sick, even if they're just tired of life, doesn't matter. If you don't want to be here, give them an easy way out.
Nope. You don't get to choose to die, especially for any reason. We need to promote fighting through adversity so we can become stronger. If you flail the first sign of a struggle in life, you are missing out on so much of life. And if you continue to push forward, you're going to look back on your life, a couple months from now, a year, 5 years from now, and say, wow, I am glad I did not do that, because it feels good to come out of adversity. It makes you stronger and it develops you into the human being that you are supposed to be.
I think it has to be the individual's choice, but and I think this is where there has to be a very good evaluation.
Call me crazy, but I don't even think an evaluation is okay on this. I mean, yeah, we wouldn't want people to say, I want MAiD today and be able to actually get that, because we all very well know that tomorrow, next week, next month that you very well may not want MAiD anymore. Mental health struggles are temporary. They do not last forever. There is no one on this earth either that is doomed to unhappiness, no matter what.
I think people should have the choice. They do have the choice, right? No matter what we say, they have the choice, and people decide to die all the time.
Yes, people do have a choice, but let's encourage them to take a legal choice. Again, what is the message that we are sending to our younger generation, our kids, by being okay with this?
And the thing about depression is that it is not constant. It gets better, right? So you don't want to make a decision to die when it might have gotten better.
Exactly. Anxiety and depression are temporary. Other mental health illnesses are very treatable. Some more than others, but they are treatable.
I'm not in favor of it. I understand that people who are suffering and there's no possible cure, why they want to do that. I'm not sure a person that's mentally ill is cognizant enough to recognize what that decision means.
Very true. You know this. When you are in a bad mental space, you tend to think not very rationally, not very logically. When we're in that space, we tend to make decisions based on our emotions. And choosing MAiD feels like a very emotional approach to working through a mental health struggle.
I think that it is not necessarily the best idea to be marketing it right now as here you go, medically assisted death if you're mentally ill.
Can you imagine MAiD being a legal thing for mental illness? Struggling with your mental health? No worries, we can help. MAiD. I know that's kind of effed up, but this whole thing is kind of effed up.
If you've been struggling with treatment-resistant mental illness for decades, for most of your life, and your quality of life has not improved in that time, I don't see why that's any different to a low quality of life from a physical illness.
This is a good point, but I also think this is an extremely rare case scenario. Dare I say that this scenario is close to, if not 100% impossible?
Not for mental illness, it has to be a physical disease.
You might be thinking, well, shouldn't physical illness and mental illness be treated the same? Because I've said that before, not for this case, but more because of what this guy says right here.
Because people can be in the depression, and believe it or not, you may feel there might be no hope, and then a month later you might feel there is. Whereas if you've got a disease that you're going to die from, you're going to die from.
No, I don't. Definitely not. This should be offering a cure rather than an easy way out.
Maybe cure isn't the right word, but let's get these people the resources they need in order to get them back on their feet and feeling good.
I understand that the hardships that it would that people would be going through, but I think that if someone's going through suicidal tendencies or things like that, I think what they need is more professional help.
Support.
Definitely not suicide.
I don't think death is the answer.
Exactly. But why does this matter to you? This MAiD program is actually legal in 10 states in the United States, but not for mental illness, thankfully. And we don't want it to be. Here's 4 reasons why you don't want medical assistance in dying to be a thing for mental health. Number 1, this is far too big of a decision for someone to make who is struggling with their mental health. Many people who are struggling with mental health battle with suicidal thoughts. So we shouldn't create an easy way to make this happen for people, especially since the vast majority of people who do have suicidal thoughts end up able to pull themselves out of this and live happy, content lives. Number 2, we need to teach people that struggling with mental health is just a normal part of life. It's going to happen.
It's normal to feel like that.
And unfortunately, there's no easy way around it. People, especially our younger generations, need to learn tools to help improve and work on their mental health. Providing MAiD to them stops all that and keeps them from overcoming adversity, which in turn develops them into a stronger, more capable individual that they were destined to be. In my experience, there is no better feeling than overcoming obstacles that life throws at you. Now, don't get me wrong, they suck in the moment. But when you're able to grind yourself out of there, pull yourself out of it, and overcome that obstacle, woo, that pride that you feel, that confidence that you feel in yourself feels so good. Number 3, the funds that it would take to create this MAiD program for mental health could easily be reapplied, like I said earlier, to giving these people mental health resources and the help to help them. And lastly, do we really want anyone making money off people choosing to medically be assisted in dying? This just sounds like a really easy way for people or companies to take advantage of individuals going through a rough time and for them to be able to make a buck out of it. That's really messed up to think about, but there's definitely people and companies who have no moral compass who would be totally okay with doing that. Suicide is not the answer to mental health struggles, and neither is MAiD. Apparently, though, there are governments out there who believe that suicide is not an option, given that it is illegal, but on the other hand, MAiD is okay, and that just doesn't sit right with me. Why do you think governments are pushing this? Is it because they can make more money this way? God, I hope not. Or is it something else? Let me know in the comments what you think about all this. Thank you all for watching. Before you go, please make sure you go check out my book that's coming out. You can check it out at feellessanxious.com. It would mean the world to me if you went and pre-ordered a copy. Thank you in advance. And until next time, see you next week. Peace.